he has this wheezing sound when he's coughing.
This is Malte. He's been ill for some time. Linda, his mother, thought it was nothing more than a bad cough. But when the cough persisted, she became worried.
First I thought it was maybe a normal kind of flu, but then I was concerned because his symptoms got much worse. And he got this wheezing sound in his cough and also blush in the face. And then I was a little bit worried, so we decided to see the doctor.
If you think Malte is an isolated case, think again. Despite current vaccines, whooping cough affects almost 50 million people a year around the globe. And your child could be next. In the fight against whooping cough, European scientists have joined forces. The project's called Child-Innovac. Dr. Camille Locht is the head of the team.
So the Innovac consortium will try to put forward, all the way through clinical trials, a totally new concept of vaccination against whooping cough. The new vaccine really aims at protecting the youngest and most vulnerable population, that is the young children of our countries.
Whooping cough is caused by the bacterium Bordetella pertussis. The bacteria are transmitted by droplets when infected people cough and sneeze. Inhaling these droplets causes further infection, which, if not treated quickly, can lead to death. Since the 1940s, the main treatment against whooping cough has been with vaccination. The first generation of vaccinations were crude and led to serious side effects. The second generation, used today, is an improvement, but is still far from perfect.
The major disadvantage of the second generation vaccine, like for the first generation vaccines, is that they require at least 3 immunizations to be optimally protective. And the immunizations in Europe start usually at 2 months of age. They go from 2, 3 to 4 months of age, which means that children below the age of 5, 6 months are not optimally protected.
Child-Innovac aims to tackle whooping cough in a number of innovative ways. First of all, it's developing a new vaccine which can protect babies under the age of 6 months, as currently none exist. To make the vaccine has meant getting to grips with the root of the disease, the whooping cough pathogen. Scientists have discovered the pathogen makes several different toxins. The pertussis toxin, which causes infection and suppresses the immune system. The dermonecrotic toxin, which can kill cells. The tracheal cytotoxin, which attacks mucus cells. By genetically modifying these toxins, scientists have created a new live bacterium, and that's the basis of the new vaccine. It's here at InnoGenetics in Belgium where the live bacterium is produced. The cultures are carefully grown and counted before eventually being used to make the new vaccine. And it's how this new vaccine will be administered that's the second innovative approach regarding the Child-Innovac research.
In contrast to the first and second generation of vaccines, the new vaccine will be a nasal vaccine. The idea is to mimic as much as we can natural infection, because we knew from clinical studies that we did that natural infection induces the best immunity in small children.
The nasal spray is not only much cheaper, hopefully it'll mean the end of painful injections too. Developing a new vaccine takes many years, and obviously the question everyone wants to know is, will it work? In Ireland, Dr. Bernard Mann and his team have been investigating the vaccine to see how effective it is.
We test the vaccine by taking 8 to 12-week-old young mice, and then we infect those mice with the whooping cough bacteria. Then we look to see how strong the immune response is in those mice. And finally, we look at the architecture, the fine structure of the lungs to see that the vaccine is safe. Let me show you what I mean. Here we see a section from a healthy airway. This mouse has not seen the virulent whooping cough bacterium. And the airways themselves are very clear and clean looking. So that's a very nice lung that we would expect to see in a healthy individual.
But it's a very different story with the lungs of an infected mouse.
What we see is a lot of destruction of that fine architecture. That gets destroyed. And then there's also a lot of damage to the lining of the lungs and inflammation as cells come in to try and kill the bacteria that are infecting. But now if we look at the airways from a mouse that's been immunized with the new vaccine, the fine architecture of the airways is protected and preserved, and the airways are clean and open and with no damage. So that's a really good sign to us that this is a safe vaccine for the children.
The exciting results from Ireland mean Child-Innovac can begin to plan the first human tests. Professor Rigmor Torstensson will be keeping a watchful eye during the trials.
To make sure that this vaccine is not causing any side effects, we will start to vaccinate healthy males. And they will be vaccinated in 3 different groups, starting with a low dose, followed after some weeks of a middle dose, and then after another couple of weeks we will use the highest dose of vaccine.
After vaccination, each man will give blood and saliva samples so doctors will be able to see how the new whooping cough vaccine compares to those currently in use.
It will take at least up to 10 years until we have the final vaccine approved by the European medical agencies. It's a long way to go.
Nevertheless, the results to date look very promising.
I'm very happy about the results. The results in animal models are excellent. And so I feel this is an award of 25 years of basic research on the whooping cough agent, and we're very excited about trying it for the first time in man very soon.
This project is very important, both scientifically, but also that you feel that you can actually help and contribute to the health of small children, and that's very important for me.
Thanks to the dedicated work of the European scientists of Child-Innovac, it's hoped whooping cough will soon be silenced once and for all.